Good day, ma'am and sir. My name is Marjorie Dela Rosa from BSN 1A, and in this video, I'll be performing the proper procedure on assessing the heart and the anterior chests. So before proceeding to the assessment, I must do the following first. First is to gather the necessary equipments, and for this assessment, it is the stethoscope. Then I would be introducing myself to the patient, explain what I'm going to be doing, why is it necessary, and how can he or she cooperate. Then I would be washing my hands and observe other infection control procedures. Then I would be providing client privacy, and I would be determining whether the client has any history on the specific assessment area. Then I can proceed to the assessment. Come in. Okay, so you are Miss Dela Rosa po, am I right? Yes, I am. Okay, so I am Marjorie Dela Rosa. I am a student nurse in here, and I will be assessing your heart and your anterior chest for today. Okay pa? Okay. So for this one pa, I just wanna let you know pa that before going in here, I've already washed my hands. Okay, so for this one pa, we're gonna be inspecting your heart and palpating and auscultating your heart and your anterior chest in order for us to know if there is any abnormalities or any abnormal findings pa. Okay, so for this one pa, I wanna make a brief lang po na you'd have to parang open your anterior chest area po, so we can so it will be exposed to us, and we can inspect it po thoroughly, and we can palpate and give you the accurate reading. Okay. So, ma'am, I'm gonna ask you a few questions lang po, just a few briefing lang po before we proceed to the assessment. Okay. So, ma'am, have you any when coming in here po, have you have any parang chest pain, or in the past po, have you have any chest pain or heartburn, like what they want to call it? Yes, a little bit. Okay, so that is good to know. Okay. So for this one po, did you have any past illness po parang that is related to your heart and to your chest? No naman po. Any surgery po that involved the heart and chest? Uh, no naman po. Okay, so that is good to know. Okay, so ma'am, now we're gonna be proceeding to our assessment for the heart and chest. Okay, so when I will go out muna po to get my supplies po, and when I come back po, pwede po na hubad na po yung top niya, and bibigyan ko na lang po kayo ng extra parang tela po, or parang damit para pwede niyo pong gamitin. Okay po? Okay. Sige po, hintay lang po Okay, ma'am, I am back po. So, I'm gonna be explaining po muna kung ano pa mangyayari. Okay po? Okay. Okay, so for this one, what would be happening is that to inspect, to assess the heart and anterior chest and the central venous cells and the carotid arteries, what we're going to be doing first is that to simultaneously inspect and palpate the precordium and for the any presence of abnormal pulsation, leaves and heaves, and we're going to be also inspecting and palpating the aortic and pulmonic areas, observing them at an angle and to the side, and to note the presence of any absence of pulsation. So as we palpate, we can feel it, man. So if we don't feel anything, we would be documenting them. So another one is we're going to be inspecting and palpating the tricuspid area for any pulsation and heaves and or lifts. So for this one, another one is that we're going to be inspecting and palpating the apical areas for pulsation, noting its specific location. It may be displaced laterally or lower. There are some cases that shows na dyan ang location niya. So also for the diameter, and if displaced laterally, we're going to be recording the record and distance between the apex and the MCL in centimeters. So what we're going to be also doing is that we're going to be inspecting and palpating the epigastric area at the base of the sternum and the abdominal aortic pulsation, and we're going to be auscultating the heart in all four anatomic sites: the aortic, the pulmonic, the tricuspid, and the apical or the mitral. So for the carotid arteries naman is that we're going to be palpating the carotid carotid artery in here. So we're gonna be use extreme caution as well kasi medyo andito siya. Then we're gonna be auscultating the carotid artery. So for this one, ma'am, I would want you to follow lang po what I'm gonna be saying. Okay po? Okay. Okay, so for this one, the heart and the central vessels. So we're gonna be first inspecting and palpating the precordium for the any presence of abnormal pulsation, lifts, or heaves. So for this one, it is best to examine the precordium with the patient in the supine position, because if the patient is turned to the left side, the apical region of the heart would be displaced against the lateral chest wall. So this would be distorting the chest movement. So there would be no really actual reading or correct reading while we are going to be palpating and auscultating the chest, the anterior chest areas. So we're gonna be having the patient in the position first. Ma'am, I need you to be in a supine position first, okay? Okay. Okay lang. Sige po. Wait lang. We're gonna putting the patient in here so mas clear siya. Ay, sorry. Okay, the patient is in a supine position. Okay. So once the patient is in a supine position, we will begin with the general inspection. So in here, I will be looking for any scars or skeletal abnormalities, for any heaves or lifts. So any implantable cardiac devices, yung parang kung may problema sila sa heart, some people, they have parang devices that would help pump their heart and keep them living. So in there, we cannot see any man. So I think the patient is normal rin naman. So for this one, or any ECGs, telemetry, stickers, yun, or any apex beat, yun. So for this one, so now we're gonna be palpating the apex beat, and here, in here. This is the brass part, just there under there. So this is the most inferior lateral point where the pulsation of the heart is palpable in here, there. When it is found, identify the anatomical location to determine if it's displaced. So some people, they have it higher, some people, they have it lower. So if any case of says of that one, we would be documenting them. So for this one, it should be located in the fifth intercostal space. So to do this, just measure in here your four fingers there. So 1, 2, 3, 4. It should be in the fifth in here, just there. So if it's just above, or if it comes in the fourth intercostal space, or very low, parang around 6 or 7, that would be not diagnosed but documented as a displacement of the apex beach. Okay, so for this one, once we have that line, if it's impalpable, so that is only if na parang di po siya ma-feel. So for this one, so if it's impalpable, hindi po siya ma-palpate there. Locate the fifth left intercostal space, again in here, there, on the mid-clavicular line, here, as the first location of the for the auscultation. So when we're going to be auscultating, in here in the fifth intercostal space. So now I will be feeling for any thrills there, which are palpable murmurs. Okay, so none naman. So next, I would be feeling for the parasternal heave, which is evident in the rise of the ventricle hypertrophic. So that one. So precaution is not done in this cardiology exam. So feel for any heaves and feel for any murmurs there, or the thrills. Okay, we don't feel naman any. Okay, so after this one, we're gonna be proceeding to the auscultation of the precordium. So now I'll be auscultating the precordium again. So with this, with my left hand, I'm gonna be gonna aid the carotid pulse so that the systole and diastole are distinguishable. Okay. So now I'm gonna start with the diaphragm of the stethoscope. This one, the bigger one. The stethoscope, and listen to the heart in the following sequence. First is the apex. Okay, the tricuspid area, the aortic area, the pulmonary area, and the carotid arteries there, just below the neck. Okay. Okay. Ma'am, I want you to take a deep breath in, deep breath out. Okay. Then just hold it in for a while, okay? Okay. Okay, so now I'm going to be changing to the bell of the stethoscope and listen to the heart in the same sequence. So, in here naman, bell, I'm going to be changing it first. Okay. Ma'am, take a deep breath in, deep breath out, then begin. Okay, so if a murmur is heard, comment on where it is loudest and where it is where does it graduate? Is it a diastolic or systolic? What grade is it? Describe its intensity, pitch, or other features. So now I'm gonna be asking the patient to do the breathing, to do some breathing exercise. So for this one, pa, ma'am, please take a deep breath in. Okay, then breathe it all out, all the way. then just hold it in. Now the dynamic maneuvers are performed to unshade any murmurs at that may be present. Okay, so for mitral regurgitation, without moving the patient, I would be listening with the diaphragm in the axilla with the patient and full expiration. Okay, ma'am. Again, I would be instructing you to take a deep breath in, then breathe out all the way and just hold it for a while. Okay po? Okay. Okay, deep breath in, deep breath out, hold it. Okay. Good, ma'am. So now, we're gonna be doing it on the other side na naman, okay? Ma'am, deep breath in, deep breath out, hold it. Okay, okay. So now what we're gonna be doing is ask the patient to take a deep breath in, then out, then exhale all the way, then hold it again. So this is for the mitral stenosis. So what we're gonna be doing is to place the bell on the mitral area more, then move the patient into the lateral decubitus area for full expiration. Okay. So in here. Okay, ma'am. Deep breath in. Deep breath out all the way. Okay, then hold it, ma'am. It is in the bell. There. Okay, very good po. Now for the aortic stenosis, we're gonna be placing for this one naman the diaphragm. Okay, so over the carotids in full expiration, the aortic stenosis will be heard loudly in both carotid areas. So, okay, ma'am. Okay, please anda pa ha. Sige, deep breath in. Deep breath out all the way and hold it pa. Okay. So now for the aortic regurgitation, we're gonna be asking the patient to sit forward naman. Kasi kanina naka-supine position. Sit forward. Okay. Then we're gonna be listening to the distant over to the left sternal border with the diaphragm in full expiration. Okay? So ma'am, please take a deep breath in. Deep breath up, all the way, and hold it po. Okay, very good. Okay. So, once we're done with the heart, the central vessels, and the carotid arteries assessment, we're gonna be recording them muna. And we're gonna be taking note if we have found any heaves or lifts or any abnormal displacement. We're gonna be noting them and documenting them down because it is important. So after documenting them, we're gonna be proceeding to the next assessment. Okay, so for this one, the jugular vein. So jugular veins first is these are several veins of the neck that drain blood from the brain, face, and the neck, returning it to the heart via the superior vena cava. So for this one, what we're going to be doing is we're going to be inspecting the jugular veins for any distension first. So to do that, we're gonna be needing to put the patient in a semi-Fowler's position first. Okay, so we're gonna position the patient there. Ganyan ang semi-Fowler's. Wait lang. Let me get something. Semi-Fowler's position. Okay. There in a semi-Fowler's position na. So for this one, what we're gonna be doing is that we're gonna be locating the jugular vein first. So for this one, because we are looking for the increase in the central venous pressure, okay? So to do this, I'm going to be first locating the stenomastoid muscle, so which is in here, the big muscle there in our neck. So which runs right here, or in the patient in here, but it can't be seen. So now once we find that, we're going to be finding for the external jugular vein. So it just all overlays the stenomastoid muscle. So in here, this is the stenomastoid muscle. So it can be seen in here, overlapping there. In here, as you can see, for the patient, ma'am, I need you to put your face in the left muna. Okay po? Okay. Look there. So this side would be exposed. Okay. So in here, as I can see, it is flat, which is good. Kasi if there is any bumps there, it could mean that there is any heart failure. So that is bad. So it is good that we can observe that it is flat in there. So for this one, wait lang, other side. Okay. So for this one, it can be seen through the eyes only, but it can also be seen with the help of the light, so it is more visible. So, but with that naman, with the jugular vein, it can be seen easily. So, you just really have to look for it. So for this one, we can see that it is slightly flat in the patient. So for that one, or not seeing anything at all. So for this one, when it is like this, it is okay. So this usually represents that the patient with if there is any bulging seen in there, para siyang snake-like. If there is anything seen like that, it could mean a patient with the congestive heart failure. So that is really, really bad. So what we have instead is like have an increased external venous pressure, then thus resulting to a distension. So once it is visible that there is a bulging, that is the parang JDV, or that is the jugular vein distension. So once that is done, we can proceed to the next assessment. So for the next one would be the peripheral vascular system assessment. So for this one, it would be best if the patient is in a supine position, just like this one. The patient is already in a supine position. So what we're going to be doing here is to assess the patient from the end of the bed first for a general inspection. So I'm going to be standing up for this one. Okay, so for this one, we're going to be looking for signs of obvious vascular compromise there. For any comments, then we're going to be doing a comment on any items of clinical note around the bed. So if we see any abnormalities, we're going to be noting them down, documenting them. Okay, so for this one, what we're going to be doing is to begin with the peripheral pulses. So the pulses are palpable at the peripheries. These are the hands and the legs. So they refer to the palpation of the high pressure wave of the blood moving away from the heart through the vessels and the extremities, pulses in here on both sides of the client, so the left and right. So in here, so what I will be doing is to palpate the peripheral pulses on both sides of the client. So in here, we're going to be doing it individually, simultaneously, systematically, to determine the symmetry of the pulse volume. So what we're going to be doing is palpating lang. So ma'am, I'm going to be removing this pulse so I will be able to palpate properly. Okay po? Okay. Okay. So in here, we have patient. We're gonna start with the common carotid artery in here. There. Okay. So now is the brachial artery in here. Okay. The radial artery. Okay. Ma'am, I'm going to be touching the inside of your thighs. Okay po? Okay. The femoral artery. The popliteal artery in here. Just like in the knees there. The dorsalis pedis artery in here. I'll remove the shoes. Ma'am, I'll be removing your shoes first. Okay. Okay. Then the posterior tibial artery in here. Okay, so once we have that, we're going to be documenting them. So in here naman, what we're going to be doing is to assess the peripheral veins. So in here, we're going to be inspecting the peripheral veins in the arms and legs for the presence or any appearance of these superficial veins and when limbs are dependent and when limbs are elevated. So we're going to be assessing the peripheral leg vein for signs of um, pelvitis. Okay, we don't see any abnormalities naman. Okay, ma'am, thank you for that one. We're going to be moving on po sa peripheral perfusion. So in here, I'm going to be inspecting the skin of your hands and feet for color, temperature, edema, okay, and skin changes. Okay, so we're going to be assessing the adequacy of the arterial flow for the arterial insufficiency if suspected. So after that, we're going to be documenting the findings in the client record. So if we see any presence of superficial veins, we're going to be documenting them. But as I can see in here, there is none naman, okay? So now we're gonna be moving on to the breast and the axillae. Okay, so what we're gonna be doing is inspect the breast for size and symmetry and contour or shape while the client is in a sitting position. So ma'am, can you please sit po? Okay. There. So we're gonna be inspecting it in here. Just look at it. There. Okay. So in here we're gonna be inspecting the skin of the breast for localized discoloration or hyperpigmentation, retraction or dimpling or localized hypervascular areas, swelling or edema. So in here, you can see naman it is fair. There's no discoloration. There's no parang different colors in here. Okay, the size is just the same. There's no swelling in the other side, no signs of edema, and so on. So that is very good, ma'am. So in here, we're gonna be emphasizing the retraction by having the client raise her arms above the head. Ma'am, please raise your hand. Okay, there. Okay, then hands together. So we can see the flex, the elbows. Okay. Then the hands down to on the hips. There. Okay. So now we're gonna be inspecting the areola area for size, shape, symmetry, color, surface characteristic, and any masses or lesions. So the areola is the darker side of the nipple. So it surrounds the nipple talaga. So we're gonna be checking first. Okay, as I can see, hers is light pink or palish na brown. So it's just the right shape and size for her body. So that is good. So now what we're gonna be doing is to inspect the nipple for size, shape, position, color, discharge, and lesions. So if the lesions are here, the nipple are there in the center of the areola. Okay, inspect. Then now we're gonna be palpating the axillary, still in a sitting position with the arms abducted. So like that. So make sure that the patient has proper balance so the patient can hold on to you. So for this, the axillary in here, the subclavicular, okay, the supraclavicular lymph nodes in here. Okay, other side. Ma'am, please raise your hand. Okay. 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 I don't feel any masses naman. I don't feel any parang bulging lymph nodes, so that is good. So now what we're gonna be doing is we're gonna be um, so now we're gonna be palpating the breast for masses, tenderness after inspecting them for any discharge of the nipples. So together, we're gonna be palpating the areola and nipples for masses naman. So to do this, we're gonna also compress each nipple to determine the presence of any discharge. If, for example, hindi pa siya buntis or hindi pa siya mom, so it should be parang strange that there's milk or there's a fluid coming out of the nipple. So that may be a sign of other illnesses. So we're gonna be palpating them first. Ma'am, I'm gonna be palpating your breast area. Okay po? Okay. Sige po. Okay. Ma'am, I'm gonna be parang pinching a bit your nipple area to see if there is any discharge. Okay po? Okay. 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 So that is good. So now I do not see any discharge. There was no discharge on her nipples. So for this one, if there is a discharge that occurred, assess any discharge for the amount, the color, the consistency, the odor. Is it yellow ba? Does it smell slimy or is it like milk lang like that? So we're gonna be noting for any tenderness on the palpation as I have did it the palpation. The patient did not react in a painful manner naman. So I don't think there is any tenderness or there's any sign of painful parts in the palpation. So for this one, we're gonna be teaching the client a technique for self breast examination. So because if they feel any parang bumps in there or lumps, it may be a sign of breast cancer na rin kasi. So that is hanggat sa maaga, maagapan siya. So we're gonna be teaching the client how to perform a self breast examination. Then after that, we can take notes and document our findings na. And that would be the end of the heart and anterior chest assessment. So, ma'am, thank you po for coming in here today, for letting me assess you. You did great, ma'am. Thank you po. Okay, thank you. You can change na po. Okay. So, that marks the end of the PE, the proper procedure on assessing the heart and the anterior chest.